Hello, thank you so much for joining us. My name is Susan Ward, and I am with the Office of Social and Emotional Wellness.
My name is Lisa Hayward, and I am thrilled to be here with my dear friend and colleague, Susan Ward, also from the Department of Education. And today we are really excited about our guest speaker. Today we've got Heidi Cloutier with us. If you don't know Heidi, she is the project director at the UNH Institute on Disability. And today she's going to be sharing and talking with us about her initiative, Creating Connections in New Hampshire. So Heidi, I'm going to turn it over to you now. Susan and I are so grateful to have you here, and we're looking forward to learning more about creating connections in New Hampshire.
Great. Thank you so much, Lisa. I'm so excited to be here. I appreciate you having me. And my team at the Institute on Disability has been working over the past 20 years to improve implementation of high quality interventions and systems of support to promote resilience and community connections for vulnerable youth. So many of you might be familiar with our Renew team or our MTSS team at the Institute on Disability. I'm one of many project directors there. But today I'm here to talk specifically about Creating Connections New Hampshire and how substance use prevention and supports align within a multi-tiered system of supports for emotional and behavioral health and wellness. And so the Creating Connections New Hampshire Youth Treatment and Recovery Continuum of Care is really we're operating under a federally funded project through SAMHSA to develop and implement a system of care for youth ages 12 to 25 with substance use disorders and co-occurring mental health disorders. And Creating Connections is being implemented with the, by the New Hampshire Bureau of Children's Behavioral Health within the New Hampshire Department of Health and Human Services to develop a continuum of youth treatment services in collaboration with 5 community mental health centers in New Hampshire, the Institute on Disability, 3 community recovery organizations, and the Human Service Research Institute for evaluation. This initiative supports youth and young adults with substance use disorders using research-based treatments and peer support in the Seacoast, Laconia, Manchester, and southwestern regions of the state. So when folks get a call for or a referral around substance use disorders or co-occurring disorders, an intake is conducted. We're using the CANS, the Child and Adolescent Needs and Strengths, to determine the level of care and supports that would need to be put in place for that youth. And the youth is linked with the appropriate treatment and level of care. And we are anticipating that we would like to grow a network of peer and recovery supports for both the youth and the family that are linked with that continuum of care. So I mentioned there are 5 community mental health centers who are currently offering substance use treatment. The model that we're using is the 7 Challenges substance use treatment model. And the Greater Nashua Mental Health Center has been using this model since 2018 with really strong results for engaging and supporting youth and young adults. And the initial results show that youth who've participated in Creating Connections New Hampshire have reduced drug use and improved functioning in home, school, and community. And we were fortunate in March to expand to 4 other community mental health centers. And so if folks are looking to get more information or link to a community mental health center that's offering this evidence-based model in substance use treatment, you can connect with the Greater Nashua Mental Health Center of Greater Manchester, Community Partners in Dover, Seacoast Mental Health Services in the Seacoast area, and Lakes Region Community Mental Health. They are, so all but Nashua is just getting trained in the 7 Challenges model now. We anticipate that by July, they'll be ready for referrals. Nashua, if you're in the Greater Nashua area, I would encourage folks to reach out to Greater Nashua Mental Health. They're good to go now. But by next school year, all of these mental health centers should be up and running. which is exciting. So, oops, my apologies. So we know that substance use recurrence rate for individuals with substance use disorders is about 50%. And for young adults, it can be even higher. Young people struggle to maintain their recovery while navigating stressors of adolescence and emerging adulthood. And we hear countless stories about lack of treatment availability. I know I personally have worked with a number of adolescents who've indicated that they want to reduce or stop using substances, but it's easier said than done. When youth are faced with the prospect of losing their entire peer group or their social network in order to maintain their recovery, their commitment can waver. And it takes a community as well, right? So it takes a lot more than commitment. And this is where alternative peer groups can really come in and support youth in their recovery. So alternative peer groups are community-based and allow space for young people in recovery to engage in fun, substance-free activities and make new friends with youth who understand the temptations of substance use, and to develop health and wellness strategies to maintain their recovery. The groups are run by young adults with lived experience in recovery who are trained and receive ongoing supervision. And we have a continuum of family supports available as well. We're trying to really grow family leaders within alternative peer groups. So parents who are parenting children in recovery, reaching out and providing peer support and that family component to other families who might be just starting out in their recovery journey. So we've got 4 alternative peer groups in New Hampshire currently, and Live Free Recovery was the first alternative peer group. They are out of Newton, New Hampshire, and they'll be expanding to Rochester very soon over the next month. We've got Hope for Recovery, which is launching their alternative peer group on June 12th. And they are in the greater Manchester area. And then Revive Recovery Center in the greater Nashua area. And so I've included the hyperlinks as well as phone numbers for folks to reach out to those organizations directly. We really want to grow a network of recovery communities, right? Around the state of New Hampshire, we know that youth and family peer support is so important to recovery, and think that growing that in connection with a multi-tiered system of support can be very impactful. So if you have questions, please visit the Creating Connections New Hampshire website or reach out to me directly at the Institute on Disability through email or phone. And before I go, I want to put a plug in for some upcoming privacy webinar series in an effort of ongoing integration and collaboration. We know it's really important to coordinate care for young people in recovery. And so we're offering some New Hampshire privacy webinar series coming up June 30th and September 7th. And I've included those hyperlinks as well. Thank you so much for having me today.
Thank you, Heidi. That was extremely helpful to hear. And it's wonderful to see all of these peer support groups really just helping their peers and working together in the state of New Hampshire.
I can't wait to find additional opportunities to collaborate. Sorry, Lisa.
No, I just rudely interrupted you, as I often interrupt people quite unwillingly. Thank you so much for your time and for putting together this really informational presentation. We hope anyone who watches this will be reaching out with any questions, or if they want us to make a connection with you, we are happy to do so. But thank you again, and an absolute pleasure having you join the Office of Social and Emotional Wellness at the Department of Education today.
Thank you.